Hi, I'm Peter Gloviczki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery, Venous and Lymphatic Disorders. We are pleased to announce that the new impact factor of the JVSVL is 1.619, the highest among vascular journals dedicated to venous and lymphatic diseases. The September issue includes several excellent papers you find worthwhile to read. The Editor's Choice article is on the 24-month results from a randomized trial of cyanoacrylate closure versus radiofrequency ablation for the treatment of incompetent great saphenous veins, a multi-institutional study authored by Kathleen Gibson and colleagues. In this prospective trial, 222 patients were randomized for incompetent great saphenous vein treatment to either cyanoacrylate closure using the Venous closure system or to radiofrequency ablation using the Closure Fast system. 171 patients completed the 24-month follow-up with similar closure rates in both groups. Recanalization-free survival was 94.6%, non-inferior in the cyanoacrylate group compared with the radiofrequency group that was 87.8%. There were no significant device or procedure-related adverse events in either groups, and the venous clinical severity score improved significantly in both groups. There were similar significant improvements also in the quality of life scores measured in both groups using the Aberdeen Varicose Vein Questionnaire and the EuroQol 5D instrument. The authors concluded that cyanoacrylate closure can be recommended as a safe and effective method for great saphenous vein closure up to 2 years after the intervention. Our CME paper in September is entitled Presence and Degree of Residual Venous Obstruction on Serial Duplex Imaging is Associated with Increased Risk of Recurrence and Progression of Infrainguinal Lower Extremity Deep Vein Thrombosis, written by Taewan Yo and colleagues from the Ohio State University in Columbus, Ohio. In this retrospective single-center study of 185 lower extremities of 156 patients with acute deep vein thrombosis, follow-up duplex ultrasound demonstrated residual venous obstruction in 61.1%. Larger initial clot burden was associated with an increased risk of residual venous obstruction. Multivariable analysis revealed that recurrent DVT was associated with the presence and degree of residual venous obstruction, and limbs with complete clearance and no residual venous obstruction had a decreased risk of recurrence or progression. These data suggest using follow-up duplex ultrasound in patients with DVT to identify those at an increased risk for recurrence or progression and to help guide the duration of anticoagulation therapy. The next article is entitled Characterization of Profundofemoris Vein Thrombosis, authored by Dr. Tanner Rappella and colleagues from the Oregon Health Science University in Portland, Oregon. This prospective cohort study enrolled 260 patients with proximal deep vein thrombosis. Of these, 23.1%, 60 patients had DVT involving the profundofemoris vein, either as an isolated DVT or as a combination of involvement with the external iliac, the common femoral, and the femoral veins. Those patients who had profundofemoris vein thrombosis had similar cumulative survival than those who had no profundofemoris vein involvement. But they had more thrombus burden, had more frequent concurrent DVT in the external iliac and femoral-popliteal veins, and were more likely to have hypercoagulable disorders and immobility. The authors concluded that ultrasound protocols for assessment of DVT should include routine examination of the profundofemoris vein as a potential marker of a more virulent prothrombotic state. The final paper we would like to introduce to you is entitled Trends in Vena Cava Filter Insertions and Prophylactic Use, written by John Power and colleagues from the Icahn School of Medicine at Mount Sinai in New York. Now, this is a retrospective analysis of inpatient health data from the national inpatient sample. The authors analyzed trends in prophylactic vena cava filter insertion in the United States adult population from 2000 to 2014 and found that the annual percentage change in vena cava filter insertion increased before and after publication of the PREPIC-2 trial, dropped after the 210 FDA administration safety alert, and stabilized after 3 to 4 years. Operative trauma, orthopedic surgery, and neurosurgical procedures were most associated with prophylactic vena cava filter insertions. The authors recommend further investigation of prophylactic IVC filter insertions in trauma, in orthopedic and neurosurgical patients to determine if current levels of use are justified. These were just 4 of the many excellent articles from our September issue of the JVS Venous and Lymphatic Disorders. To access these articles free this month, please download them on www.jvsvenous.org. Enjoy reading all JVS journals, submit your research for publication, and see you next time for the highlights of the November issue of the JVS Venous and Lymphatic Disorders.